Henry Kaiser once said, "Of all the things I've ever done, I expect only to be remembered for my hospitals. They're the things that are filling the people's greatest need, good health."
So here we are 50 years later. We're providing health care across this country to over 8 million members in 8 different states. It's a concept that worked back then, and it's still working today.
In our communities today, Kaiser Permanente is committed to helping serve the growing numbers of low-income, uninsured, and underserved populations.
Our program with the Child Health Plan is a very good example of that. We take care of over 4,000 kids. Another example would be our health fair, where over 3,000 people from around the community that don't have access to high-quality care and service were served by over 500 Kaiser Permanente volunteers.
In addition to providing great clinical quality of care to people who have illness, we also have a very thorough program around education and programs to help people prevent getting into those illness categories.
And Kaiser is focused on making their facilities as convenient as possible for the communities they serve.
And one of the most exciting things we're doing right now is this new project in Lafayette, Colorado, which really takes our old centralized model of hospital care and put it into 2 locations in town to make it more convenient for more people.
And Kaiser is at the forefront of re-engineering the delivery of care.
But one of the areas of greatest excitement for us is in the use of the automated medical record. There's been a lot of talk about this nationally, and what we're betting on in the future is the reinvention and redesign of healthcare by having a very thoughtful, very engaged, very computer literate workforce with significant physician leadership around redesigning healthcare.
We're in the position today of what kind of a response can we as an organization bring to the large employer, the small employer. But the ultimate solution around affordability is to really reinvent healthcare. That's the challenge that we've got today. It's the long-term opportunity, and it's one that we're embracing and are actually quite excited about.